Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
My name's Brenda. I was born in Leicester, grew up in Loughborough and went off to university in Leeds to do a degree in geography. After that I came back to Loughborough and taught in fact at Melton Mowbray in a secondary school for 30 odd years, which I enjoyed very much. When I retired, shortly after I retired, I was diagnosed with esophageal cancer in 2010 and it is now 2013 and I am still here.
Well, Brenda, thanks for coming in to share your story of how you managed your cancer. I heard your introduction there. You are somebody who's been diagnosed with an esophageal cancer. Is it okay to ask you about how that came about from the start?
Yes, that's fine.
How did you discover that diagnosis?
In the autumn before I was diagnosed in, I think it was the February of the next year, I went to my GP with recurrent indigestion and heartburn. All the various treatments that he gave me seemed not to touch it, at which point he scared me nearly witless by telling me I was the right age for stomach cancer and he would send me off for an endoscopy, which he duly did. They discovered a polyp, which, using that word, didn't frighten me in any way at that point. Had they said perhaps growth or something, I might have been a little more aware of what was going on. And it came back that there was a very early stage cancer in the esophagus and I would need major surgery.
So that was definitely, a piece of information that, wasn't welcome, a shock if you like, to the system. Do you feel that they gave you enough information then for you to know that they could do something about it?
At the point at which I was told it was cancer, yes.
Yeah.
I got a really good feedback on what the operation would consist of, that because it was early stage, I wouldn't need any other therapies, for which I was immensely grateful, that it would be surgery for most of a day. There were 2 surgeons on it. I spoke to the anaesthetist and he explained the process there and the various risks of it. And yes, I felt that I was as well informed as I could be on that.
What was the next step then for you?
Right, after the diagnosis, it was really just to get admitted into the hospital and then go through the process of the surgery.
So you went into hospital then, and you we're getting ready for the surgery. It's quite a big operation in many cases, isn't it?
It's major.
And can you describe for the viewers what it involved in principle?
because I'd had a thyroidectomy a number of years earlier, they couldn't operate in the way that they would normally operate for an esophageal cancer. So they had to do an Ivor-Lewis, I think that's the name of it, operation, which involved a cut down the middle and then a cut around the side and remove part of the rib and put everything back together again.
How long was that operation?
5 hours.
Yes, and I know from previous experience, patients who have that Ivor-Lewis procedure sometimes go direct to ITU.
Yes,
to
I was in intensive
okay.
care. I live with my sister, and obviously she was supporting me along the way. I think I was in there for 3 days in intensive care, 2 days or 3 days. I know I told her not to come and see me because I didn't think there was any point when I was going to be fast asleep. But you know, when I woke up, she was there, which was nice. Then I went from intensive care to a high dependency ward, and I was on that for the most of the rest of my stay in hospital. I think there was only the day before I was released that I went on to a lower dependency ward.
Really? And how long was it until you were discharged from hospital?
I think it was 10 days, something like that.
So you had quite an extensive recovery period in hospital.
Yes. Yes.
And then at the point of discharge, how much back to your normal self were you?
Oh, I should say probably less than 60%.
Really?
Yeah. They'd obviously had to put an awful lot of fluid into me while the operation was going on, and my legs had swollen to a huge size, and I was really quite perturbed, but I was told that would go, and it did. So, yeah, I would say I was definitely well under par, possibly even only half my normal sort of self. Decision making is one of the things I think that I've found quite hard with this illness.
Yes. So then you returned home. Was it a relief to finally get home?
Oh yes, yes. I mean, I was released on a Friday before a bank holiday, which is not ideal, but and there were a couple of issues with one of the wound dressings on the side burst, and I had to get the district nurse out to deal with that. That wasn't all that easy and a bit worrying, you know, when you don't quite know what you should be doing with it. And I was on a jejunal feed? The tube that goes into the top of the stomach?
Yes, to make sure you were getting sufficient nutrition.
Yeah, I found that really hard to manage. I could not seem to get the amount that I was told I should do into me. But I was actually able to eat when I got home. In the hospital, I hadn't been able to eat anything. They'd been very good and tried to give me some very high protein soups and such like, and I just couldn't get them down. So I don't think I had very much apart from ice cream before I went home. But at home, I actually did manage to eat.
Did you manage to get back your appetite and also...
Not my appetite. I knew I'd got to eat, and my sister was sort of sorting out my meals and things for me and making sure I did eat. But it wasn't something I enjoyed.
No.
And anything that she's put before me then I never want to see again, to be honest. It's really weird. But that was quite hard initially. But as I say, the feed tube, I just could not get it to work sufficiently, and you're limited to where you can go when you've got it. You know, if you need to go to the toilet, you've got to carry the blooming thing with you while it's whizzing away, and it was that I found a bit difficult. I think I should have been on it for longer than I was, because after about a fortnight or 3 weeks maybe, it fell out in the shower, and I didn't, to be honest, I didn't know what to do, and I phoned up the NHS helpline and didn't get a lot of advice on what to do. I guess it's such a specialised area that they wouldn't know the answer to it. But in the end, Kathy, my clinical nurse, said to me that if I'd gone into the hospital within about 4 hours, they could have put it back. But things were okay. Things were okay in the end.
I bet it was a relief not to have that though.
It was, although I didn't do it deliberately, honestly. It did just fall out. Yeah.
Managing then without it, was your weight then stable for a while, or did it still go down a little bit?
No, it was stable. I never have a problem with putting weight on.
I mean,
I can do it easily.
There is a concern, isn't there, about the appetite, eating and weight after this cancer in general, and also after your surgical procedure.
It didn't seem to have. I think I have found that I now have a much better idea of how much I can and can't eat. And obviously it is reduced because the stomach is now a much smaller size. So I do have to watch that. And I found that having several smaller meals was easier. Initially there were some foods that I found very difficult to eat, things like bread. And I still find bread very hard to eat. And I'm not entirely sure why, but it is. Things like soups and things with more moisture in them are easier to eat. I do have a problem still with iron. I'm vegetarian, which is always an issue for vegetarians anyway, and absorption of that I think is reduced. So I have needed to be on iron tablets to just manage that. I hadn't really realised why I was feeling so tired until we discovered I'd become anemic as a result of that. So there are one or two things, and I keep on a multivitamin tablet as well, just to make sure that I'm getting the right balance of things.
And has your taste for certain foods changed over time?
No, I don't think so.
So in principle you like the same things?
I think so. Yeah,
except those things that you were being required to eat, you said, from your sister.
Yes. Yeah. Bless her. Yeah. I suspect actually, as I was recovering, it was probably harder for her than it was for me. I know when I was on the painkillers and I'd come out of hospital, she used to come and check that I was still breathing at night because I was so static and such like. And I know, she's told me afterwards that was quite hard for her.
So you returned home eventually, and like you said, that was a relief to get home. What were the key steps in that recovery and rehabilitation process at home? What was influential?
Right. Trying to get back into a normal eating and exercising and just doing the day-to-day things that everybody does. I think I wanted to get back to normal.
Yes.
As if this was all finished behind me. I live with my sister, as I said, and she was producing my meals, and I'm vegetarian, so it's a bit difficult anyway. And she looked after me in terms of food. I had a feed tube in the top of my stomach as well in the hospital, and I found that really hard to manage. Not the technicalities of it, somehow the practicalities of it. I couldn't seem to get it to fit into my life and to sit there for long enough to take the 1,000 calories or so that I was supposed to have with it. I don't think I ever emptied one of the bags completely, however hard I tried. But I was eating slightly more normally anyway. Small meals fairly often. Bread, a big problem. I would have coughing from that. I think I had a couple of episodes of what people call dumping syndrome. I don't know whether people are aware of that, but not very much of that. I had a few early days symptoms of vomiting at the end of a meal. I think I'd not judged how much I should have, so that was a bit unpleasant. But that didn't last too long.
Can you explain the dumping syndrome to the viewers?
Right. It's when the sphincter at the end of your stomach empties straight into your gut, and then you have to take a very quick trot to the toilet because it goes through the digestive system very quickly. I'm told it's very common, so I'm very happy that I didn't have much of it. And so, I I think some people have more of that than I did. So eating, I got back to normal fairly quickly. I'm still have to watch how much I eat, and I can't really manage an entire main meal. If I go out, that's it. I don't manage an entire main meal. Starches are a bit tricky. I guess they fill the stomach up and there's not much space for it to go, so I try to keep those a little bit lower so that I get sufficient of the other nutrients to balance things out. I have had a couple of bouts with anemia. I think, again, the iron is not being absorbed in quite the same way as it used to be. But again, I've had tablets for that and that's worked. And I take a multivitamin as well to make sure that I have the complete range of nutrients that I need. So by and large, the food issue is not too bad. One of the difficulties, and again for me this is still ongoing, is heartburn at night particularly. So I sleep with blocks under the mattress and on about 4 pillows, but I still often wake up in the night and need some relief from that. So that I suspect is going to be the norm for the future, to be honest.
How easy has it been to get back to where you were before, i.e. getting back to normal?
Well, I think the first 6 months or so after the diagnosis, I was still probably less well than I thought at the time that I was. After that, after the 6 months and after I was told that everything inside had healed and I could actually start to do the things that I'd done prior to the operation, I think that helped tremendously because I could get back to doing the gardening that I enjoyed, going back to my yoga classes, going to my gym, all of those things that helped me to manage myself. I could do all of those. Looking back, I'm 3 years on now, looking back, I think it took me 2 years to kind of come out of it. It's almost as if, this is going to sound very strange, I think, but almost as if those 2 years are in a kind of little box. And so I just don't want to think about those too much, thank you, because I'm now fit and well and back on, as I was beforehand. So, I think it's only been in the last year that I've been able to think about the future in any coherent way.
What do you think's helped? What resources or which individuals do you think have helped you over that 2-year period?
Going back to the hospital is very helpful. I do find Kathy and Sue very helpful.
Your own clinical nurse,
my clinical nurses and my dietitian.
Yes.
I found them very helpful. Being monitored like that is also helpful because you do the blood tests and the checks and everything, and that gives you that sense, yes, things are okay. Obviously my sister, who's looked after me a lot of the way, and just getting back to doing the things I did before. Going back to the groups I used to be with before.
Which groups are those?
I walk with a number of colleagues from work, all retired. We call ourselves the HRT group, happily retired teachers, and we go walking once a month. So I found that very useful. My yoga class, because I think that helps tremendously, because I'm discovering that if I don't maintain my core muscles, I get some problems. Whereas if I maintain the strength in my core muscles, things seem to work okay within the digestive system. And I just find yoga very relaxing as well. Would you advise that for other patients who are in that rehabilitation phase? I think some exercise. I think it does depend. I mean, I go to hatha yoga and it's not excessive, and we always work at our own pace, so that suits me. It may not suit everybody else. Swimming I find very useful as well. So yes, any of those sorts of things I would recommend. But again, I did that before, so that works for me. It may not work for everybody.
Was that also a kind of monitor so that you could check your own progress?
Yes.
You knew
Yes.
what you were capable of before?
Yes.
And you could see how much you
Yes.
could do,
Yes.
how fatigued you would get.
Very much so.
And what did you find during year 1, 2 and 3?
That there were, certainly within yoga, there'd be some exercises. I think, yeah, I'm going to pass on that one. There are still a couple that I can't do. There's one called the bridge where you have to lift the hips up above the head, and I don't do that in case there's any unpleasantness. But most of the others I can do, and maybe it was a case that instead of 3 repetitions of a movement, I would do 2. But gradually that built up.
Did you tell them in the class?
Yes, I told my teacher.
What happened?
I told my teacher. She's very understanding. She just keeps an eye on me, and she knows the kinds of things that I just sit out, as it were, and do something else.
And how about on the swimming side? What did you find in terms of your abilities?
Well, I think age has taken its toll, and I can't do as many lengths as I used to. But otherwise, yes, again, it's a building up. You know, so many lengths this week and slightly more the next, and gradually building the strength back up again.
And now, how are you able to perform compared to your previous normal before the cancer diagnosis?
I think it's roughly the same if you take into account that I'm 3 years older than I was. I think it's roughly the same, yeah.
Well, that's good. In a sense, that tells other people that there's no reason not to aim to get back to normal effectively.
I don't feel there is, no. No.
In fact, are there any limitations now, 3 years down the line, on your lifestyle in general?
I find that I'm a keen gardener. I find that when I'm gardening, because there's a lot of bending, an hour and a half of solid gardening, and I can't do any more.
Yeah.
But I manage fine on that, so yeah.
That's good. You mentioned about your own personal motivation and drive. You wanted to get back, to where you were, and you obviously kind of set yourself certain targets and then did test the water to see how you were getting on. Do you think that's an important part, to feel that you've got a target, to give yourself a bit of a push in a way?
It is for me. I don't know whether that would work for other people, but it is for me, yes.
Because the other side of that, then there is a temptation to say, well, I'm not well, I'll just rest, I'll wait till my body's recovered naturally, I'll not do too much.
That doesn't suit me. I'm naturally somewhat impatient.
Yes.
And I did not want to be in hospital any longer than I had to be. I did not want to be recovering any longer than I had to be. And provided that I didn't hurt myself in the recovery, which I didn't, I was really quite careful about it. I was determined I was going to get back to normal.
That's good. I believe that in the past you had experience of another illness, in fact another cancer, and I'm wondering how things compared at that time.
Very different. About 15 years ago, something like that, I had a thyroid problem. I'd been going regularly to the hospital to get it checked because it was a multinodular thyroid, so it was very obvious, and then it swelled into more of a goiter, and I went to the stage where I was running around like a blue bottle and not sleeping more than about 3 hours a night, and they decided to remove the thyroid, which they did. And then when I went back after the surgery, I was told that there was actually a small cancer in that. And that was the first I'd even thought that it might be a cancer. In fact, I hadn't thought about cancer at that point at all. So to be told that was quite shocking.
Yes.
And I found that very difficult because I couldn't tell my sister about it. And I didn't want anybody to know. And I have no idea why I didn't, but I didn't.
Was it the culture then about cancers that people didn't talk about them as much?
I think it was. Yeah, I think it was. I think, you know, people think, oh, cancer, or, you know, she's not going to be around. And again, I've been very lucky because I was told it was small, it hadn't spread, I didn't need any further treatment, and it was something that generally wasn't lethal in that sense. And again, that's 15 years or so ago. So I go for regular checkups annually on that one, and touch wood, things are fine.
Do you think there is a stigma in society about cancer that prevents people really talking about it openly?
I think people are scared of cancer, and they're scared of how you are going to respond to having had the diagnosis. I think they're very concerned about what should they do in that situation. How should they then relate to you? How should they speak to you? Do you want to talk about it? Do you not want to talk about it? And I think all of those make it very difficult for people to know how to handle it.
So in a sense, there's two things. There's how do you feel in yourself about telling information, you know, giving information which is quite personal. But there's also what is the reception from others, and that's somewhat unpredictable. For example, some people might be very supportive and want to be there all the time. Some people might avoid you because they think, well, I'm not sure what to say.
Almost as if it's contagious. And it's I don't think it's other than the fact that they don't know how to handle it. You know, and you're having to handle it as well, you know, so you've got that dual kind of thing. How do you handle it, and how do you handle it with regard to those people who are around you? And I think that's a very personal thing. I mean, if people had been around being too touchy-feely and supportive with me, I would not have liked it, because it doesn't suit me. Other people, it might have done, you know.
We certainly come across other people ourselves who are not sure what to say, whether to reveal that diagnosis. And we've had people in the programme who've chosen not to say anything about their diagnosis, even to their family.
I say, in the first diagnosis, I just didn't know how to tell my sister. For the second one, she was with me.
She came with me
to the appointment because we had both got the impression, when we were called back after, I had 2 endoscopies. When we were called back after the first one, very quickly I thought alarm bells started to ring, and I thought, oh yeah, this is too quick. This is, there's something here that I need to be aware of. And so she came with me to the second one, and she came with me to speak to David Bowery, the surgeon, and throughout it, really.
Is that a tip for viewers, that ideally it would be nice to bring somebody to their appointment?
I think it's quite helpful, yes, because it's another pair of ears as well to hear what's going on, because when you hear that cancer, you're not always sure that you've heard everything that goes after it.
No.
And therefore to have a second pair of ears there listening and just sort of absorbing things. I used to write things down because that helped me. And any questions I had, I would write out a whole list of questions in my little blue book that I took with me when I went to speak to people, just, you know, to make sure I was okay with it.
As a kind of aid to communication?
Yes.
Did that help? Or
yes. Oh,
it
yeah,
did.
yeah.
Definitely.
Because again, in that situation, you can't always remember things.
That's right.
I'm afraid.
Because it's a stressful situation in general, even the follow-up appointments.
Yes. Oh, yes.
So having thought about it in advance and then taking a kind of checklist.
Yes.
It helps keep the focus on what is important for you at that time, doesn't it?
Yeah.
And also having a relative there helps.
Yeah.
But would you believe that about 30% of people who attend their appointments here locally for their cancer, either diagnosis or follow-up, come on their own?
I did the first time. So yes, I would believe that.
Quite a few do come on their own.
I did, yeah.
And there is a question in the hospital, should we be helping people who don't have someone to ask at that time? Should we be giving them an advocate, in a sense, from the hospital resources?
I'm not sure I can answer that one. As I say, the first time I did it on my own, the second time I took my sister, so I'm not sure what the answer to that is. I tend to think that people would tell you if they needed something, I think.
Hopefully that's the case. Do you feel that the society has changed its attitude to cancer over the decades that have gone recently?
Yes, I do. I think back to when my mum and my dad died from it. It's a very different sort of culture to today. And again, I think that's because there's an awful lot of media representation of the risks and how to check. There's a lot of work and information that comes out about success rates and such like. So I think people are better informed about it, and that maybe helps. What
did you notice when your parents were unwell with the cancer? What cancers were they?
Well, Dad died of lung cancer, but I was only 18, so I was kind of not taken into it. People didn't say, you weren't warned that this was cancer, nobody told you. So when my father died, we were only told afterwards. Whether that was because we were young, I don't think it was. I think it was people didn't say.
Yeah.
And again with Mother, we knew something was very badly wrong, but we were not actually told. And as a result of that, I think we made choices with her and for her that we might have made differently had we been aware of them.
What condition did she have?
We're not absolutely sure. She died with multiple cancers because they had to have a post-mortem for her.
Yeah.
But so I don't really know where it started, to be honest.
What do you think about the way cancer's handled in the media and in organisations, voluntary organisations these days?
I don't know about voluntary organisations as much. In the media, I think it seems to be less scary in the media somehow. It seems to be, these are the risks and these are the possible outcomes. I think it's more a bit demystified.
Yes.
And I think that does help.
Yeah. I'm interested in the question about your lifestyle, and particularly also in relation to work. You said you were a teacher, is that right?
That's right, yes.
And you retired shortly before the diagnosis,
yes.
the esophageal cancer diagnosis. Yeah. How long before was it that you retired?
Just over 2 years, I think, something like that.
And had you had a chance to get into the retirement lifestyle?
Oh yes.
What were you doing with yourself?
I got myself sorted out with my gardening, with learning how to paint watercolours, which is something I've always wanted to do. Going to yoga classes, to the gym, going walking with my friends. Basically just doing what I wanted to do instead of what anybody else told me to do.
It sounds like the retirement was going quite well for you.
Very well. I'd got into a situation where, as many retired people will tell you, I don't know where I would have found time to go to work.
Did you have some contact with your previous work colleagues?
Yes, I would see them fairly often for meals or walks or such like, yes. Because most of us started work at much the same sort of time, we'd worked together for a very long period of time, we'd maintained that continuity.
Yeah. So what was the effect of the cancer on that situation, and also, whether colleagues knew about what
Colleagues did know about it. I decided it wasn't something that I could really kind of keep to myself. It was going to be fairly obvious for a while. So yes, I told one of my closest colleagues, and she said, well, was she to tell anybody, or did I want it to be kept private? And I said, no, you can tell people. Yes, I got a lot of support, a lot of cards when I was in hospital. People visited me when I was at home. So yes, it was very, very helpful.
Good.
Yeah.
Did you find colleagues were continued to be supportive throughout? Because there's the initial period, you've been diagnosed.
Yeah.
Then there's the hospital period, but then there's a long time when you're trying to get back to how you were.
I didn't really tell an awful lot of people in the period between diagnosis and the operation. I think people knew fairly hard upon the operation occurring. After that, yes, people were very helpful in the recuperative stage in those first couple of months or so when I was just getting back onto my feet. After that, and I was able, since I was able to drive really, things were a lot easier because then I could see people and do things. Yeah.
What are your plans for the future at the moment?
At the moment, plans are really just to have some nice holidays. We come back fairly recently from just over a month in New Zealand, which was wonderful. So I think we should probably do things like that. I don't really have any, if you call, long-term goals like that. I'd quite like to go back to the United States again on a holiday. So I'm afraid it's holidays that are more my plans than anything else. Yes.
Do you think that the cancer experience has changed you as a person or changed your outlook?
I think it's changed my outlook, yes. I don't think I plan in as long a term as maybe I used to. But apart from that, I suppose it's made me accept that I'm not always going to be able to do everything that I want to do, and to be a little more conscious of my physical limitations and listen to my body a little bit more than maybe I used to. So yes, I think it's probably altered that. Yeah.
Some people sometimes say that good things can come out of the diagnosis, even though it was, something you wouldn't want to face. That all things considered, you can take what's important in life and really appreciate things again. Do you think that's the case for you?
Yes, I think it is. And you appreciate your friends and your family much more. Yeah.
What are the next steps, if any, for you? I mean, you've got these potential holidays planned. You've got quite a nice lifestyle now.
Indeed. Really just to maintain it, to make sure that I do try and consider my health as I go through, and just try and keep as healthy as I possibly can.
Are you still having to attend for monitoring at the hospital?
Yes, it's reduced now. There's a sequence, obviously, you go, I think, after the first 6 weeks, then every 3 months, and then every 6 months, and then it's annually, and I'm on to annually now, which is good. Yeah.
Does it still create an anxiety having to go for a checkup?
No, it doesn't, apart from parking at LRI.
That tells me that your confidence about your condition is very good. That if you get a provocation, a stimulus, if you like, by having to go for an appointment, it doesn't really weigh on you that much. You're still able to just go through with it as a routine, if you like.
I guess because I was told that the cancer was very early, that it hadn't spread. I have faith in the surgeons and in my nurses, and I think that, makes me less anxious. Yeah.
Thinking about everything you've been through, the whole cancer journey, do you think anything could be improved? Do you think anything could be changed to make the way we handle things a little bit more easy for patients in the future?
I think, comparing my two experiences, I think in the first case, people were much less upfront about the possibilities, and had they been, I think I would have been more comfortable with things. In the second incidence, it did help for me to be told what was going on, what the process was going to be. I needed to know that. Again, I don't think everybody else would necessarily need to, but for me, it worked to be told quite clearly what was going to happen, what the situation was, and what the likely outcome was going to be.
What could we do from the hospital perspective to improve things then? For example, could we have more support in place? Could the information network be better? Could the communication process be improved?
I think it would have helped me to have seen something like this.
Yes,
before the operation, or maybe even to have spoken to people who had gone through the same process. I think that would have been quite useful.
Yes.
I feel that my surgeons and the nurses gave me the information I needed when I needed it. When you're out of hospital, I'm not quite so convinced that the going home process is quite as good as it might be, the discharge. That certainly took a long time for me on the Friday. I remember I'd been told in the morning I was going to go, and we didn't get out until about 6 in the afternoon. So that, I think, could have been a little smoother. And when you're then handed over into the community care, that was again perhaps not quite as smooth as it might have been. That's not to say, things didn't work in the end. They did. It just took a little bit longer, I think, than perhaps I would have liked.
You mentioned about the possibility of meeting or seeing other patients. Did you ever get that even by chance, because you were attending and somebody there, you happen to have a connection with them?
No.
You never really had that opportunity?
No, not at all. Again, I mean, if you're sitting in the waiting room, you don't know quite what people have had or whatever. And unless you meet again the couple of people who were in beds next to you, you wouldn't know. And I didn't. No. So no. I did go to one of the support groups. That is how I managed to volunteer for this. And I think I might go to the second one of that. And what I found very useful there was a gentleman who said he had been diagnosed 8 years ago. And I found that extremely helpful. I have at the back of my mind, he's still here after 8 years. So...
that's encouraging, isn't it?
It was very encouraging.
To say they've done well.
Yes.
And they had a similar condition to you.
Yes.
That's ideal, really, and that's partly why we're creating this video diary program.
It's why I volunteered for it. Yes.
Okay. I wonder if you could have a think for me. If we've got a viewer watching this along the lines we were talking about, who's newly diagnosed, and they're watching your account. Is there anything you'd like to say to them, in relation to what to expect or how to get through it?
Ask the questions that you need to ask. Write them down if you need to. I think you need somebody to look after you. In my case, don't worry about pain. There was almost none. The pain management treatment was absolutely spot on. Make sure you do have faith in the people who are treating you. And there is life after it.
Definitely, and you're a testament to that.
Indeed.
So I'd like to thank you on behalf of myself and the viewers
You're
for
welcome.
Coming in today and sharing your account. You're actually the first person with an esophageal cancer who's female who's given their story.
Oh, right.
So that is incredibly
Hey, first. Right. Yeah.
So that's really important, and the fact that you've had 2 cancers and come through them, and in a way, yes, the climate of society has changed a little bit over the last decade or 2. You've been kind of a witness to that.
Yes.
Hopefully now people are a little bit more comfortable about speaking out about their diagnosis. But I want to thank you personally for coming in and sharing your story. It's been a really excellent account.
Thank you.
Thank you very much.
You're welcome.